Many people think that mindfulness is not very scientific, and last year, 2019, there was 1,449 new papers on mindfulness published in peer-reviewed scientific journals. There's a lot of science around. What we know from mindfulness now is that it doesn't just train attention and improve focus, which is important for a whole range of reasons, but it also has an effect of unwinding the stress response. So there's physical health benefits. It literally changes the structure and the function of the brain in a very positive way. But it also helps a person to communicate better, relationships, better physical health, but better mental health is probably the most important area.
Many healthcare professionals have that type A personality, high expectation, hardworking, always striving for better, more. And I think one of the flow-on effects from that is anxiety and stress. Whether you're a nurse, a paramedic, a doctor, you are always trained. The first thing you're trained to do is to look out for danger. You know, Dr. ABC, you have to protect yourself, because if you don't protect yourself, you're of no use to anyone. My version of Dr. ABC begins with making sure that I'm safe. And that's not just, is there a power line nearby or something? Is there a fire? It's, am I safe from a personal point of view, from an emotional point of view? Because the better I am performing, my patients reap the benefits, and that goes across the whole healthcare sector. Everybody's going to benefit more if every member of that team and every person in that pathway is comfortable and calm and considered and has perspective and has as little stress and anxiety as possible.
I think health professionals really need mindfulness, firstly to cope with workload and the emotional demands that come with the job, dealing with vicarious stress, the stress and distress of patients and families. So there's that whole area, but we know that mindfulness helps people to be more compassionate, but also to communicate better. So the more attentive and present the health professional, the better they communicate, the more empathy they have, the more pro-social they are.
I feel like Smiling Mind is a really efficient way to bring mindfulness to people who don't necessarily have a lot of time. It's really easy, it's really quick. You get fresh new reminders, it's evidence-based, there's a lot of science behind it. So for people who want that scientific content, it's there. But at the same time, a lot of people think that mindfulness is hours of, quiet meditation. It just doesn't have to be. It can be 5 minutes here or there. It can be once or twice a week, it can be once or twice a day. And you've got that flexibility with Smiling Mind, and I find that that's what draws me to that particular product. For me, it's a no-brainer.
In a time of adversity, like dealing with COVID-19, there's a massive increase in the amount of interest in mindfulness now, which I think is fantastic. It's like the adversity is a kind of a wake-up call. And mindfulness can help in lots of ways. I mean, firstly, it just improves our immunity and resistance anyway, which is pretty good, with a bug floating around. But also, the fear and anxiety about COVID-19 is more contagious than the actual virus itself. And so, but what can also be contagious is a little bit of calmness, a little bit of equanimity in the midst of adversity. And that can be contagious too, in a very good kind of way.